act leaving this normal behavior so that you'd never know. These were the words spoken by a young poet by the name of Devin Murphy while competing in a competition called the Breaking Voices. And the them that he was referring to in this statement were his repetitive tics and compulsions caused by Tourette syndrome. In this particular poem, he was describing his embarrassment towards his tics and compulsions and the desire to be normal. So some severe cases of Tourette syndrome have even gone so far as to have patients stay in their homes for as long as 4 years. And because of these occurrences, scientists have been trying to find a certain cure or treatment to help stop this disorder. So during the process, the only way to begin to find a cure is to find the cause of the disorder. So during the process of trying to find the cause of this disorder, they found one conclusive diagnosis of how Tourette syndrome is caused, which is genetics. This brought me to my main topic of this presentation: is the cause of Tourette syndrome only genetic? Here's my table of contents that ranges from the definition of what Tourette syndrome is to the conclusion of the research that they've done in order to find the cause of Tourette syndrome. So my first question when researching what Tourette syndrome is what is it? And what I came to find was that Tourette syndrome is a neurobehavioral disorder characterized by motor neural tics. And what tics are repetitive muscle contractions that produce stereotype movements or sounds. This disorder starts from the average age of 7 years old and progresses in frequency and severity during the beginning of puberty, which is around the ages 12 to 16, and decreases in severity and frequency in most cases during the beginning of adulthood, which is about the age of 24 to 40, around that age. So although this disorder can be classified as neurobehavioral, it's not usually easy to be diagnosed because it is neurobehavioral. And what neurobehavioral means generally is that it shows the reactions that the brain has to certain things. So because the brain is one of the most misunderstood parts of human anatomy, it's not very easy to diagnose certain certain disorders that have to do with the brain. So one of the earliest findings of Tourette syndrome, or that is said to be Tourette syndrome, is written in a 15th century manuscript called the Malleus Maleficarum. And what was written in this manuscript was that a priest that began to have certain odd behaviors, such as saying things that a priest generally wouldn't say, or doing things that he seemed not to be able to control. And because of the lack and an insufficient amount of technology in those days, they diagnosed this disorder, or they called this disorder a possession. And the only way that they thought they could treat this possession is by having an exorcism. What an exorcism is a church or a priest by himself goes and performs a ceremony in order to try to abolish or remove this demon from this person. And in most cases, it didn't really work because it wasn't usually a possession, but just Tourette syndrome or another disorder. So, as I said before, the average age of Tourette syndrome patients is 7 years old and progresses in frequency and severity during pubescent years, and decreases in frequency and severity during the beginning of adulthood. So statistics show that boys are more affected than girls in this certain disorder. And about 1,000 per 100,000 children are affected with this disorder. Although this may seem very common, it's research has shown that most of the 1,000 cases in this disorder are mild cases, so they may have mild clinical features and may never be brought to medical attention. So not to lessen the severity of this disorder, but it is like just comparing it to a more severe case that may need to be brought to medical attention. So other interesting information that regards Tourette syndrome is that it's commonly associated with obsessive compulsive behaviors. So one suspected cause of obsessive compulsive behaviors and Tourette syndrome is that it affects the same part of the brain, which is the basal ganglia. And what the basal ganglia is primarily responsible for is the things that you filter out of what you say. So a person with obsessive compulsive behaviors with Tourette syndrome may not be able to stop certain things you want to do, which reduces the tics and the repetitive tics and compulsions. Also, the average age of this disorder that both these disorders start is about the age of 7 years old. What's also interesting is that obsessive compulsive behaviors increase in frequency and severity during the beginning of puberty and decrease in frequency and severity during the beginning of adulthood. Also, it's said that about 50% of Tourette syndrome patients exhibit obsessive compulsive behaviors. So here are some of the suspected causes that infections, birth defects, allergies, hormones, and stress. And even though I didn't decide to do my entire presentation on all of the different causes of disorders, I did choose to do one on infections that may cause stress syndrome. So it is suggested that your autoimmune mechanisms may have a role to play in the cause of Tourette syndrome. And in the late 1990s, a group of researchers got together, a group of 50 children, and described them as having a pediatric autoimmune neuropsychiatric disorder associated with streptococcal infections. And what they found was that during the research, they found that the patients that had been diagnosed with Tourette syndrome had at least 3 months prior infection. 3 months prior infection of streptococcal. Yeah. This brings me to my research design of how they came to find that this infection, that streptococcal infections cause Tourette syndrome. The objective of this research was to assess whether streptococcal infection is associated with the increased risk of Tourette syndrome and other related disorders. So the materials that they used for this was 144 children. And where they got these children were from an organization called the General Health Center, or General Health Cooperative. And the children ranged from different ethnic backgrounds, different ages, different heights, weights, and so they had all different types of factors. They also used throat cultures to retain samples of streptococcal infections, an incubator, and a laboratory where they did other research. So how they started this experiment was by examining medical records to see when the onset date, where the date of the onset symptoms of Tourette syndrome started. They then had a population of children that weren't from the GHC, organization, population of children that were from the GHC association, and they took them and they divided the information that they got from both of them. And then because this was mostly about Tourette syndrome and other and tic disorders, they excluded ADHD from this population of the 144 children. So they then re-examined the medical records of these 144 children and to see where the streptococcal infection when and where the streptococcal infection had occurred. So the procedures that they used for gathering the streptococcal infection samples were they obtained infections from medical labs when they had gone to when the 144 children had gone to the doctor for streptococcal infections, and they incubated them overnight in the lab. So here are the results that they got from this. So the numbers in the parentheses are the percents, and the numbers are the actual numbers of the children. So here you can see that 144 children were the total, 102 of them were males, and 142 of them were females. The rest is to say whether they were diagnosed with OCD or Tourette syndrome, or OCD and Tourette syndrome, and so on and so forth. Here's the data that they gathered from the examining the medical records and examining the streptococcal infections. They saw that, so what they did is they saw that 12 of the cases had strep throat within 3 months of the onset diagnosis of Tourette syndrome. And another example is how they showed that patients with Tourette syndrome and no OCD had, there were 3 cases that had that had 3 months prior to onset diagnosis of Tourette syndrome. And in conclusion, they did find a strong correlation between Tourette syndrome and the streptococcal infection. And they're still continuing with research that may one day help to diagnose and cure these disorders. One of the limitations that they had for this was that if the medical records did not have the onset date of it, they would pretty much ask the child when they started to have symptoms of streptococcal infection or strep throat. And this wasn't really a really reliable idea of when the infection started because the child may not have noticed the infection while he or she was going through it. So some of the recent findings that they're doing in order to find the cause of Tourette syndrome are doing neurological imaging, anatomic studies, which are post-mortem or after someone dies. But this isn't very reliable because not a lot of Tourette syndrome patients die from this disorder because it's not really a harmful. It's a harmful disorder, but it's not really one that's deadly. They also are doing physiological and behavioral studies on rodents and non-human primates. Also, as stated before, how most of the children that had, how about 1,000 per 100,000 children are diagnosed with this disorder, they begin to relax the definition of it, and the children that don't have the most severe cases, they're beginning to say that it's non-disabling. So they're not really diagnosing this disorder as, they're diagnosing it as Tourette syndrome, but they're not saying it's a very severe case. So the significance of this research that was done was to help to confirm a possible cause of Tourette syndrome. They're still doing research on it to completely confirm it and have an inclusive diagnosis of it. It also has given hope to certain Tourette syndrome patients that feel that they're not able to go on with life, or as I stated before, they put certain limitations on their lives as staying inside their homes because they're experiencing embarrassment. So this research is giving them certain hope to help think one day maybe there might be a cure. Questions, comments, or constructive criticism?
Yes, Ms. Love. Good presentation. Regarding the percentages of people that derive their Tourette syndrome from different causes, has there been any studies to discuss or perhaps estimate what the percentage of causes are linked to this streptococcal infection or any other cause?
I'm not exactly sure what studies are being done at this moment, but what I did find was that they were doing certain research on it, like that they were trying to see what children had it before they came in to like be diagnosed with streptococcal, to be diagnosed with Tourette syndrome.
Okay.
I'll get back to you on this research.
Thank you.
Ms. Alonzo.
Thank you, Ms. Love. You mentioned that children in their adolescence, that's when the Tourette's, the tics and compulsions are the most severe, and then they kind of become less severe after that. Are there cases in which the tics and compulsions completely go away?
I haven't read anything on that, but something that is not really similar but opposite to that is that a woman had become more severe, began to have more severe cases of Tourette syndrome during like her adulthood ages. So there might be a possibility that that has happened, if it's completely just gone away, but I'll get back to you.
And so, have studies been done on these like specific few where the symptoms continue to be severe, and how they may be different than those who have?
Yeah, there has been this, my journal article is actually on a case where it's become more severe, where the woman had begun to have